It's a Northwest News Radio weekend. IRG's Health Talk continues.
All right, our next guest is Dr. Neil Batta. He's discussing cervicogenic headaches, what they are, what causes them, and how to prevent them. And this has got to do with your spine, apparently, Shannon.
Yeah, your cervical spine, there's a lot of muscles and connectivity, and, your cervical spine, those muscles can cause tension headaches, but there's other things and other reasons you can have headaches. And Dr. Neil Batta is going to talk about how you navigate and trying to understand what is causing your headaches. Tom, you and I both know if you wake up with a headache or ever have a headache, man, it's miserable. So he's there to help people and track down what is causing these headaches, but the cervical spine sometimes can be a culprit.
All right, let's hear from Dr. Batta right now.
Welcome to Health Talk. How are you?
Good. How about yourself? Thanks for having me.
Oh, yeah, you bet. I'm doing great. Listen, I'm excited to talk to you. You're at neospine.com. You're a physiatrist by training, but I think our listeners would like to know a little bit about you, your background, kind of your area of practice, your area of interest. So give us that kind of background story of you and how you got into what you do today.
I grew up in Buffalo, New York, born and raised, very big Buffalo Bills fan, of course.
Oh, absolutely. I was just going to ask you that.
Yes, 100%. I did my medical training in Philadelphia Medical School in Washington, D.C. And after training at the University of Pennsylvania, I did a residency in physiatry. I did a fellowship in pain medicine. And met my wife, who's from Bend, Oregon. And so she wanted to come out here to Gig Harbor. And so we found our way out here. And I've been here since September. I was hired by NeoSpine to work out of Gig Harbor in Silverdale. So we've actually started 2 new clinics there, and I've been building the practice over the last 6 months. I practice primarily pain medicine, which includes an array of procedures under X-ray ultrasound, nerve studies, spinal cord stimulation, and then studying different pain etiologies, much like the headaches and back pain, neck pain, and a lot of different types of pain. So, I enjoy medicine. I love what I do. And, that's part of the reason I wanted to, come out here and talk and just, continue to reach the patients and for education and things like that. So I really enjoy what I do.
Well, it sounds like you have a passion for what you do. And I want to give you a big shout out because what you do is not easy. And what I mean by that is you have patients that come in, and anybody that deals with patients that have chronic pain or just pain in general, that's always a challenge. And we're here as a physical therapist. I know we're here, and as a physiatrist, to help the patient and reduce that pain. Let's talk about a particular type of pain that I'm sure you see a lot. And you recently did a webinar for us, and you did a great job. Thank you. But the title was cervicogenic pain. And that's a big topic and a big term, but let's talk about what that is.
Yeah, absolutely. So it's really, when you think about headache, it's a spectrum of etiologies, and whether it's a migraine headache, a tension headache, a medication overuse headache, they all kind of fall under the same array of symptoms. And cervicogenic headache is really a headache that has a known cervical insult. So that's a cervical injury, and the headache develops in like a temporal or time relationship to that cervical injury. And when that cervical injury resolves, the headache should also get better. And so I think that's the crux of what a cervicogenic headache means, like a true cervical source. Differentials just with the anatomy. And like you were saying, there's so many things in the neck that can cause all these pain, right? You're thinking about the joints in the neck, thinking about the jaw, you're thinking about just any muscles in the neck, up from the upper cervical spine, into the head. And then of course there are always dangerous etiologies. I think there's strokes, there's different kind of neuralgias as well. And so I think when you're looking at headache, it's just important to take in the overall spectrum.
Yeah. So when you talk about cervicogenic, what we're doing is we're talking about any kind of a headache that maybe comes or stems from something dysfunctional in the cervical spine, essentially. And this could be a posture dysfunction. What we've seen, particularly with the pandemic, is a lot of people have gone to home offices. And I know in our business, we've seen a lot of people that have postural dysfunctions or stress-related headaches from poor posture ergonomics. It could be a result of a whiplash. It could be a result of an injury. It could be a fall. And all those things can happen. And when they come see you, how do you start that process? Because it's complicated.
I think the first thing is to do a very good medical history. When every patient comes to me, I do a very thorough examination looking for, if any history of any kind of head lesions, any strokes, aneurysms, what other neuropathic or neurologic issues you have. I look at mood, I look at depression, anxiety. I think that's just a huge component to any pain, and I think it's really important to ask. And for me, I think what separates what I can do is, there's kind of 2 ways to look at it. There's a clinical diagnosis, which is much like we talked about, looking for some sort of cervical injury, and there's also an interventional diagnosis, meaning I can do some nerve blocks and injections to kind of tease out, is it from the cervical spine or not? And I think that's where I may be able to help.
More with Dr. Neil Batta and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Our conversation with Dr. Neil Batta and Shannon O'Kelly continues now.
Thank you so much for joining us here on Health Talk. One thing I do appreciate about what you do and what you talked about is your thorough examination. When we talk about what's going on, we talk about pathophysiology. Maybe you can talk about what is the cause, and then maybe you can talk about kind of that roadmap that you use to maybe get to that cause and solve that problem.
Absolutely. You know, when you think about cervicogenic headache, you picture the cervical spine. And I know there are a lot of joints, there are a lot of discs, and the discs are in between the different bones in the cervical spine or thoracic or lumbar. And there are also nerves that run in between these joints and around these joints, and all of these can be, cause the pain. What's interesting is that the upper cervical spine, as it feeds signals to the brain, and also what we call the trigeminal nerve, or kind of the nerves that go into the forehead that may be culprits in migraine or other headache etiologies, actually converge on the same pathway as they feed pain signals to the brain. And so because they converge, a lot of pain in the upper cervical spine can actually translate to being pain in the forehead. And that's kind of the pathophysiology of how a cervicogenic headache or cervical source produces pain in the head. And when I'm thinking about how to differentiate this headache, I look at all the different joints and areas and see, well, what can I block, via nerve block, via some local anesthetic to see if there's any improvement in the headache. And this is what we call with targeted therapy. Now, when I'm thinking about a pathway, the first thing I think about is a physical exam. Where is the headache coming from? Does it actually start in the neck? Is it a known cervical source? And if it is all of these, then I think about the dangerous things. Is there a brain tumor? No. Is there an aneurysm? Okay. Is there a kind of a nerve pain that could replicate the headache that I need to look into? Like sometimes a C2 nerve or very high nerves in the neck can replicate a headache. Once I've kind of looked all these out, if I'm getting MRAs, MRI imaging, then I say, okay, now that the dangerous stuff is ruled out, what about cervicogenic headache? Is there non-throbbing pain? What is the quality of the headache? Then I say physical therapy, because physical therapy is actually a proven treatment for cervicogenic headache, whether that's manual manipulation, thrust. So that would be the first step that I do. Now, if that doesn't help, then I proceed to the interventional pathway. Between the C2 and 3 vertebrae, that's the most common joint to cause cervicogenic headache. So I'd start with putting some local anesthetic there, maybe doing a radiofrequency ablation where I place a heating probe and coagulate and burn those nerves off to provide longer relief. Then you can kind of go down the joint pathway. So you go to C1 to C2 joint, then C3 to C4 joint, and that's kind of the most probable pathway down to see if that's the pain generator for the patient. So it's cool because there's, the first part, which is the exercise and the physical therapy, which is just hugely important. But then there's also a second part where we can actually specifically target where this headache is coming from. And those are really the most common sources. If those blocks don't really produce the pain relief, then I'd start to think about, potentially a different diagnosis. But that's kind of what I think about when I think about cervical headaches.
Yeah, what's really cool after talking to you and just listening to you is that you're out there and you're available to help people that have these headaches. Thank you for what you do, and thank you for coming on Health Talk with us. And we'll have you back on to catch up down the road, okay?
Absolutely. Thanks for having me. Thank you for your time.
You've been listening to Dr. Neil Batta. NeoSpine information. You can get more at neospine.com. And boy, Shannon, anybody who can figure out any way to help us get rid of headaches, I'm all for it.
Oh, absolutely. In the physical therapy world, we deal with postural dysfunction and cervicogenic headaches from muscle tension, muscle tightness, again, poor posture, particularly in the world we live in where everybody's working at a computer station pretty much, okay?
Yeah, so that's a good point.
Yeah, absolutely. So check your computer station, think ergonomics.
We're back with more after this on Northwest News Radio.